Hello, hi, namaskara. My name is Kirtan and I am a second year medical student studying in a government medical college. So today we will be talking about the topic electrocardiogram or ECG. By listening to the term electrocardiogram, you are often reminded of the sound that comes in the movies whenever there is an accident scene in the hospital, like beep, beep, beep. Yes, that sound is produced by the electrocardiograph. That is the machine which records this ECG, that is defined as the record of electrical activities of the heart through the leads, which are nothing but the electrodes which are connected to the surface of the body or to the surface of the heart in surgery cases, which records the electrical activities of the heart. So this is the electrocardiogram or ECG. So the machine which I told is electrocardiograph. This is the machine which records the ECG. So you can often get confused by like electrocardiograph. So a graph means that is the recording. No. Electrocardiogram is the recording of the electrical activities of the heart, whereas the electrocardiograph is the machine which records the ECG. So what is the uses of this electrocardiogram? Why do we need this? So there are several uses. The important uses of it are to identify the anatomical orientation of the heart. So you can identify whether the heart is small or whether the heart is suffering from any injury or something like that. Then the second use is that we can identify the relative size of the chambers, like the atrial chamber and the ventricular chamber. The third use is the disturbances of the rhythm and the conduction. The fourth use is the location, extent and the progress of the MI. MI means nothing but the myocardial ischemia. Effects of the altered electrolyte concentration. So the electrolyte concentration of the heart can vary. So we can determine it by the electrocardiogram. We can also detect the efficiency of the electronic pacemaker, that is nothing but the SA node or the AV node or the His-Purkinje fibers. So these are the uses of the electrocardiogram, or which we call ECG. So let's talk about what are the ECG leads. ECG leads are nothing but the pair of electrodes used to detect potential differences of the heart. So ECG leads can again be divided into direct and indirect leads. So the direct ECG leads are placed, these are electrodes which are placed on the surface of the heart. Directly placed on the surface of the heart. Yeah, this is used while doing the surgery procedure, like open heart surgery. In indirect, there are three types: limb leads, chest leads, and esophageal leads. So from the exam point of view, we will be talking about the limb leads. These limb leads can again be divided into unipolar limb leads and bipolar limb leads. So this bipolar limb leads is important through the exam point of view. So we will talk about this bipolar limb leads now. So these bipolar limb leads, they are lead 1, lead 2 and lead 3. So how are they divided into lead 1, lead 2, lead 3? So as you know that lead is the pair of electrodes. So lead 1 is connected from the right arm to the left arm. Lead 2 is connected to the right arm to the left limb or left leg. Left arm, the lead 3 is nothing but which is connected to the left arm and the left leg. So these two electrodes are placed on the body surface and the potential difference between these are recorded. Electrodes are attached to right arm, left arm and left foot, as I showed here in the triangle. This triangle is also known as the Enthoven triangle. This Enthoven triangle can be used to many purposes, like calculating the mean QRS axis, which I will be talking about in the next part of this ECG video. This is the first part of the ECG video. So there is an extra electrode which is attached to the right leg. It acts as a ground wire. I have not shown in this triangle, but there is an extra electrode also which is attached to the right leg. It acts as a ground wire. So this is the lead 1, lead 2 and lead 3. This is the nth Venn triangle. So now we will talk about what are the features in the normal ECG. What do you see in that machine? What do you see? How is the graph and how do you differentiate it into the waves, intervals and segments? So we'll discuss about it now. So as I told, normal ECG can be divided into waves, intervals and segments. So this is the normal graph which you can see in the lead 2 ECG. So the first one is the P wave, then the QRS wave, then the T wave. So we'll talk about this one by one here. So this is the first one is the P wave. So it is the first positive deflection and it is due to the arterial depolarization. So due to the arterial depolarization, P wave occurs. The normal duration of the P wave does not exceed more than 0.10 seconds. The next one is the QRS complex. It is produced by ventricular depolarization. This is the QRS wave. It consists of Q wave, R wave and S wave. Q wave is the first negative deflection, R wave is the first positive deflection in the QRS complex and S wave is the second negative deflection in the QRS complex. The normal duration of the QRS complex does not exceed 0.11 seconds. So you need to remember this normal duration of the P wave, QRS complex and such segments or intervals which I will be talking here, and also why it is caused. It is caused due to arterial depolarization, that is P wave, and QRS wave is caused due to the ventricular depolarization. Next comes the T wave. This is due to the ventricular depolarization again. Its normal duration is 0.10 to 0.25 seconds. So now let's talk about the PR segment. So segment generally means a flat line. So here this is a segment, this is a PR segment. So there is also ST segment here. Interval means it contains wave and plus segment. Segment means only flat line. So the first one is the PR segment. It lies between end of P wave and beginning of QRS complex. So this lies between the end of P wave, here the P wave ends, and the beginning of the QRS complex. So the PR segment normal duration is 0.12 to 0.20 seconds. Then comes the ST segment. It lies between the end of QRS and the beginning of the T wave. I have mistakenly written QRS complex here. Correct it to the T wave. So the end of the QRS complex and the beginning of the T wave. It is the ST segment. Its normal duration is 0.08 to 0.12 seconds. So next comes the PR interval. So segments only two are there in an ECG graph. So next one is the PR interval. It lies between the beginning of the P wave and the beginning of the QRS complex. So it is PR segment plus the P wave. Its normal duration is 0.12 to 0.20 seconds. So what is the significance of this PR interval? It represents the arterial depolarization and the conduction through the AV node. You can remember this point. Next is the QRS interval. Its normal duration is 0.08 to 0.10 seconds. QRS interval is nothing but the QRS complex itself. Its significance is it represents the ventricular depolarization and the arterial repolarization also, which occurs in this period. So it represents both ventricular depolarization and arterial repolarization. Whereas in the PR interval, it represents only arterial depolarization and conduction through the AV node. So the next one is the QT interval. Talking about the QT interval, it starts from the beginning of the QRS complex to the end of T wave. So here you can see here, it starts from the beginning of the QRS complex to the end of the T wave. This is the QT interval. So its normal duration is 0.40 to 0.43 seconds. Its significance is that it represents ventricular depolarization and ventricular repolarization. So now let's come to the ST interval. So it lies between the J point and the end of T wave. So you may ask, what is the J point? So as you can see here, at the end of the QRS complex and the beginning of the ST segment, there is a point. This point is called the J point. So this J point is significantly important because the rise in the J point can determine myocardial ischemia. So the normal duration of the ST interval is 0.32 seconds. What is the significance? It represents ventricular depolarization. So now comes the PP interval. PP interval is nothing but the distance between the beginning of the P wave and the next P wave. So it's measured for calculating the arterial rate. Then comes the RR interval. It is nothing but the distance from the R wave till the next R wave. It is measured for calculating the heart rate, and it is also used for assessing heart rate variability. So if there is any variability in the heart rate, we can assess it through seeing in the RR interval in the ECG. So this is the normal ECG and its components, and we talked also about the limb leads. So that's it for this video. We will talk more about ECG in the coming part of this video, which I will upload in the coming days. So if you found this video informative, please like, share and comment, and also don't forget to subscribe. Thank you.